You're probably wondering, if this is a video about chronic pain, why is this guy twisting up and wrinkling up this perfectly good shirt? Well, stay tuned and it'll all make sense. Hi, my name is Arik Goel. I'm the creator of the Goel Method and manual ligament therapy. You're probably watching me today because either you or someone close to you has been diagnosed with chronic pain. And unfortunately, that's no surprise. 1 out of every 4 adults in the United States has been diagnosed as well. It could be something like ongoing low back pain, chronic neck pain, arthritis, nerve pain, fibromyalgia, lupus, chronic fatigue syndrome. The list goes on and on. Maybe you've just recently began your journey with chronic pain and you're just checking out some different treatment options. Maybe you've had it for a long time and you've tried everything and you're frustrated because it just won't go away. Either way, I'm offering you something different today. Probably something very different than what you've experienced in the past. Something that doesn't require medication, injections, surgery. Something that's more based on the nuts and bolts of how our body works, especially when it comes to stress. Something that has a high success rate. If you like what I'm saying, if you like what you're hearing so far, I'd like you to take a second to hit subscribe and hit like, and then we're going to get started. Now, you're probably wondering at this point what makes me qualified to talk about chronic pain and its different treatments. Well, on a professional level, since 1999, I've been a medical manual therapist, and I've accumulated well over 30,000 hours treating a wide variety of patients, including many who had given up because they tried everything and nothing was working. I hold master's, expert, and instructor levels in various physical rehab techniques, and in fact, about 15 years ago, I created my own therapy called manual ligament therapy, which directly addresses the connection between your ligaments, your nervous system, and chronic pain. And this is something I will make a video about pretty soon, don't worry. On a more personal level, since the age of 14 and for many years after, I too suffered chronic pain. And in fact, I had dedicated the beginning of my career as a therapist into resolving this. What had happened was there was a point where my body had begun hurting so bad in my early 20s that I almost had to give up my career as a rehab therapist because the other conventional therapies were failing me. And I had to think outside the box in order to save my own career. And this led me down the road of looking at the body in a different way, looking at the nervous system and stress in a different way. And I ended up creating the Goel Method, amongst other things, to focus on chronic pain relief. The Goel Method and my modalities in general, they focus on how your nervous system responds to stress and how that can create chronic pain and perpetuate it. So next we're going to get into that, into detail. Again, before we get started, hit like, hit subscribe, and here we go. If you want to get back to the roots of pain and chronic pain, you have to go back to the roots of where we came from, basically from our creation. And the reason for that is because as biological beings, we have a stress response. We have what's called the fight or flight, or more technically, the sympathetic response. This response is something that either keeps us safe by protecting us, or it makes us fight for our lives. So the other side of things is a parasympathetic response, which is ideal. Parasympathetic means that we're in a rested, relaxed, reproduction-oriented, feed ourselves, healing type of mode. And the sympathetic response is, again, more of the panic, oh my gosh, get me out of here, or protect myself mode. Now, part of that sympathetic response, that fight or flight response, which is very important in what we're talking about here, is what the body does under those conditions. Now, I'm going beyond just talking about increase of adrenaline, increase of different hormones being produced, increase of blood pressure. I'm talking about what our body physically does under these circumstances. And what it does is it curls up. And to get into that whole thing, we have to go back to when we're a fetus. So when we're a fetus, not long after conception, our nervous system becomes aware enough to detect incoming stimulus, whether it's good or bad. And if it's bad stimulus, the body wants to curl up to protect itself. Hence the fetus position, the fetal position, right? In that position, we're protecting all the most vital parts of our body, such as our neck, our face, our heart, our chest, our stomach contents, our groin, all those things that make us go. Basically, we go into what I call armadillo mode, so everything is curled up into a nice ball. Once we get out of our mother's womb and we're integrated into the regular world, we still have the same response to stress. We still want to curl up into a ball to protect ourselves. But there comes a certain point in our life that we just can't do that anymore. We have to be upright and mobile, doing whatever we are doing to keep surviving in this world. Unfortunately, that response of contracting still follows us. Anytime something upsets us, anytime something makes us mad, causes us pain, our body just wants to hide from it. Same response. Our body wants to curl into a ball to protect everything that's vital on the front. Now, to make us turn into this ball mode or armadillo mode, our stomach has a very strong contractile response. In other words, it pulls everything in because the stomach is the most vulnerable part of us. It's the most sensitive part and it's the most vulnerable part. In other words, there's no bones that protect it. It's just hanging out there. Where with our heart and our lungs, we have our ribs, right? We have our cranium, our skull to protect our eyes and the brain and things. Your stomach doesn't have that. So your nervous system is very interested in preserving the contents of your abdomen, all the different organs that make us function. Our stomachs, inside and out, make a strong contraction to begin to protect it. And also our chest muscles begin to pull our arms in. The muscles on the sides of our body here and here, they pull our arms down to protect the sides of us. And the fronts of our legs want to curl up to protect our groins and also to protect the lower part of our abdomen. So when this happens, it creates a lot of disruption for the rest of the body because our bodies are not like robots. We're not in separate pieces. Our bodies are more like bubbles that are constantly moving. And the problem is because everything is connected in that bubble, if you have something very tight in the middle of that bubble, like our stomach for instance, other parts of the bubble don't function very well. Over time, sometimes a short amount of time, sometimes a long period, it becomes more difficult to extend ourselves away from the middle of that bubble. Simple things like lifting your head, lifting your arms, getting your legs out behind you. Anything that uncurls our body becomes very difficult because our sympathetic response is keeping us curled up. All those muscles that are trying to move us away from the center get fatigued. And those muscles include everything in our fingers and our arms, to the tissues on the top of our head, to tissues in our toes. Everything that's trying to fight this contractile response in the middle of our body just gets exhausted. It gets to a point where your body just can't handle it anymore. It gives up on trying to fight gravity, which I'll get into in the video about posture, by the way. It begins to give up on fighting this constant curling mechanism that we have. And we begin to have a lot of pain and dysfunction. Just difficulty moving, difficulty walking, difficulty doing simple things that used to be very easy. And along with that, a lot of discomfort in different parts of our body that just seem to come out of nowhere. But that response, that curling up response, is there. You can't get away from it. But what you can do is you can begin to try things that will reverse that response, reverse that physical response, and start to ease the tensions on our body. What we're going to get into next is a little exercise that's going to demonstrate to you exactly how this curled up response affects our bodies. So I encourage you to go grab a shirt, an old shirt, something you don't mind twisting up a little bit, something you don't mind wrinkling up, and we're going to meet back here and we're going to go through this little exercise. I want you to take your shirt and start to twist it up and ball it up right in front of about where your belly button is. Continue to twist it up, continue to make it tighter, and you're going to feel how the fabric is pulling down, especially on your shoulders, and you feel this downward kind of tug. So start tightening the shirt up a little bit more. Now try to start standing up. It's difficult, right? It's not so easy anymore. Try to lift your arm up in front of you. You also feel the pull of the shirt on your arm. It's more difficult to reach up all the way. Well, this is an illustration of what your tissues are doing on the front of your body when they're contracted because of stress. So as things get tighter, it gets more and more difficult to keep yourself upright. And from the side, what does this look like? It looks like someone with bad posture. You got this kind of hunch and curve in the upper back, and the head is going forward. Now imagine trying to be like this all the time, living like this, always against this constant pull. It creates a lot of strain on the body. One of the things I'm hoping you took away from that shirt twisting experiment was that our bodies are doing things all the time that we're not even aware of, and that some of those things will lead to pain and dysfunction. And for people who suffer from chronic pain, a lot of times the symptoms seem to come out of nowhere, and this is a very scary thing, and oftentimes lead to more symptoms and increased symptoms. As a past sufferer of chronic pain and as a therapist who focuses on it, I think that the medical world really focuses too much on chronic pain as being a chemical and cellular issue. And in doing that, they're missing the big picture of how we function as an organism. as a being that responds to stress and stimulus. Chronic pain is something that really is based in the psychological realm. Yes, the physical symptoms are a manifestation, but psychological trauma is at the root of this whole issue. The trauma we suffer as a fetus, as children, as young adults, etc., it stays with us. And it keeps getting played over and over in our brain and in our psyche. And for many people, this eventually creates a pain pattern that just seems to pop out of nowhere. The two-pronged approach to helping chronic pain is, one, a good psychologist, honestly. The other thing is knowing some very common sense ways of taking care of your body, of understanding your body. And that's what I'm trying to teach you here today. And that's what my other videos will teach you as well. And when it comes to taking care of your body, I'm not talking about a million different stretches and exercise or doing 90 minutes of yoga 4 days a week. I'm talking about some very common sense approaches to uncurling the body, to relieving your stress, to giving your body some relief so it can actually heal. What I'm trying to do here is empower you. What I'm trying to do here is to let you know that you can do something about your pain, even if you've had it for a long, long time and that you've given up. Give some of these things that I teach a chance, because there's no horrible side effects like with medications and surgery. There's not going to be an increase in pain, and there's not going to be a situation where you feel like you're worse off. But if you follow what I teach, you're going to get some relief. There's a very, very high chance, as you will, and maybe even eliminate what you suffer from completely. And it's absolutely been my pleasure to introduce you to this material, and I hope that it makes a big difference in you. Thank you.